Hello, good evening. I am Isha Thakur and I welcome you to Liberate's YouTube channel for another live session. Today, in this session, we have the privilege to host Dr. Harish Kumar Vittalbhai Patel, a very renowned name in the field of nephrology with more than 15 years of experience. He is currently working as a nephrologist and transplant physician at Apollo Hospital, Ahmedabad and Gujarat. He also did his clinical fellowship at Ottawa Hospital, Nephrology Division, Canada. He is a fellow of American Society of Transplant. He has published various research papers in national journals to his credit and attended several conferences as well. He is also a member of Society of Nephrology, Canadian Society of Nephrology, American Society of Transplantation, and currently an active member of Indian Society of Nephrology. With all of his experience and expertise, he is going to help us understand the prevention of chronic kidney disease among all of us and will also answer the related queries. Welcome, Dr. Harish Kumar, and thank you for taking out time for this session today.
Thank you, Isha, for your kind information and kind introduction of myself. And yeah, I'm going to talk about chronic kidney disease because this is what we see is an emerging issue in developing country because of the emerging diabetic mellitus pandemic across the globe, and what the projected case reports like going to be by 2045 is almost double the case what we are seeing right now as a diabetic nephropathy. So today I'm going to talk in more basic of chronic kidney disease, what exactly the kidney is, where we are, and what needs to look for all the patient or who are having risk for chronic kidney disease. So just change the slide. Next slide. So if you see there, like in our body, we have a two kidney, and the kidney are paired just beside the vertebrae, and they are lying on the posterior side of our abdomen, and they are usually 9 to 10 centimeters in their size. Can you change the slide? Is there someone there on the board can change the slide to a second number slide? Hello, is there anyone there, Isha? Hello.
Hello?
Yeah. Is
Yes,
it
doctor.
possible that
Which slide?
yeah, let me do that from my side because I have also like the same slide, or maybe can you just change to the second slide if it is possible?
Sure. Second
Yeah,
slide.
yeah.
This one?
I'm not able to see this screen, like the slide on the screen, so maybe it's just taking some time. I'm not sure why it is so. Yeah, I'm not able to see on the
Yeah,
screen. It is taking some time. Yeah.
so, doctor, you were talking about the burden of chronic kidney disease.
Burden of thought from the nephrology, what we know. Still it's taking time. Maybe I can try my if it is possible to share. Yeah. Can you? Yeah, that's okay. So this meeting is basically mean for a physician to discuss the update of prevention and prevention of chronic kidney disease. And it is possible that some of the information on specific drug is out of approval level from the Sanofi is not responsible for that, and physicians are not requested to refer to the full prescription information for any product. Yeah. So today what I am going to like cover of chronic kidney disease is about the kidney. So what are the kidneys? So where the kidneys are located? What is the kidney function? Then healthy kidney and health, and what about the kidney failure? Why do kidney fails? What are the symptoms of chronic kidney disease? Why do kidney fail? Means what are the reason from where, and what is the etiology for kidney failure? And what we can do to avoid or to prevent the kidney disease? To whom we should test? So is necessary to test everybody for chronic kidney disease, or there are certain special like certain situation in which, or which are the certain like risk factor of the patient which needs to be tested for chronic kidney disease? And later on the concluding the my talk. Next slide. So looking to the burden of chronic kidney disease, you can see that there are so many patients with having chronic kidney disease in the society, and the day by day the number of chronic kidney disease are increasing. And if you see the prevalence of diabetes is like pandemic and going to be like almost 180 million patient is going to be there by 2045 in an Asian country. So comparing to a now and after like 25 years down the road, you can see there is a almost 80% increase in the numbers of diabetic patients, and diabetes is one of the most common cause for the chronic kidney disease. So from routine practice, what we see in our patient, like out of 100 diabetic patients, 40% of our patient get the chronic kidney disease down the road. So looking to a general population, we see 1% in 10 having some degree of chronic kidney disease. And globally, if you looked at numbers, like 500 million individuals have some degree of CKD. In India itself, like there's 100 million individuals have a CKD, or maybe even more, because this is like what we see in clinical practice is just the tip of iceberg. So maybe there are so many patients are there hidden in the society while having some sort of chronic disease, but they are not being picked up because of they have no regular test or checkup. Next slide. So what and where are your kidney? So it's a basic question, and so many of you might be knowing that where exactly the kidney are located. So kidney are basically located on the back side of your our abdomen, just beside the vertebrae, and they are looks now 9 to 10 centimeter in size with the bean shape. So you can know that there is a bean like our cereal. So that is the same say, bean shaped organs are there on the back side, and they are like moving along with our abdominal movement. So they are not fixed, and they are moving and just below the liver. Next slide. So what are the kidney function? As we know, as like routinely what we see is that like we are making urine. So everybody as a lay person knows that if you have a good urine means your kidney is working. So that is not the true, because kidney has a lot of other function other than the water removal. So as I said, like as a nephrologist, we say that kidney is removing the your water intake, your waste product in terms of urea, creatinine, uric acid, phosphorus. So there are so many waste products in our body which is being excreted by the kidney. Out of these, again, there are certain toxins that we are not even looking in the blood test, and still they are managed by the kidney. So in gross way, if I'm not wrong, we are telling the kidney removes small, like middle molecule, small molecule, and large molecule of the toxins from the kidney. Other than waste product and water removal, they are also making certain hormones which is important for our good health of our body. And out of this is one of the erythropoietin which is important for hemoglobin formation, because for hemoglobin, if there is no erythropoietin, the hemoglobin will not be made. So every person with a chronic kidney disease requires some sort of replacement of erythropoietin for hemoglobin. So kidney is one of the vital organs for hemoglobin. Then comes the bone. Why the bone? Because vitamin D is active form of vitamin D is formed in the kidney. Because when we take a sunlight, or maybe we are taking some sort of dietary food which contains the vitamin D, they are the raw material vitamin D, which needs to be refined by liver first and then followed by the kidney. So kidney is the vital organ to make the active vitamin D, and which regulates the bone metabolism. Another important function of the kidney is the regulation of the blood pressure. So certain patient we see like at the age of 15 or 20, they get a severe like hypertension or very high blood pressure in the very small age. Reason behind that is so many times is the kidney, because kidney itself is a good regulator of various hormone which balance the like blood pressure, and out of this is the renin, angiotensin, and aldosterone. So this is the three hormones which basically regulates by kidney, and this regulation of this will lead to high blood pressure. And last but not least is the most important function of the kidney is to maintain the electrolyte and acid base. So whatever we every day what we eat, like in terms of sodium intake, in terms of potassium intake, in terms of hydrogen ion, means like cation intake, everything is being dealt by the kidney. It regulates either actively, immediately, or as a long term. So all these electrolytes and acid base is being excreted by the kidney, and kidney is one of the main organs to regulate acid base as well as the electrolyte in our body. So when a kidney get impaired or kidney function is deteriorated, all these parameters get deteriorated according to the stage of the kidney function, and we have to evaluate every patient in that way so that we can balance that function. Next slide. So healthy kidney and kidney failure. So what is a healthy kidney? As I said, they have a like multiple function. They have a very key role in our body. When they get malfunction, we see various symptoms in terms of kidney failure. So why the kidney is important? Kidney keeps you healthy by removing has it has tremendous value in terms of healthy function. Next slide. How do kidney works? So kidney is, as I said, is location in the abdomen. It receives the blood from the heart. So each kidney have a one artery which receives the oxygenated blood from the heart, and out of 100 ml of blood being pumped by heart, 20% or 20 ml goes to the kidney for filtration. So a one single artery of the kidney will supply to a functioning unit of the kidney. So I will go to the next slide, or maybe in next slide. I am not sure what is that, but in each kidney there is a 10 lakhs filter. So one kidney is having 1 million filters. So we are born with like 20 lakhs or 2 million filter, and each filter receives the blood from the main renal artery, and which carries that blood through the coil or capillaries which filter the blood, and then it makes the formation of the urine. So as per the previous slide, what I said, the kidney's main job is to remove the waste product, control the blood pressure, control the fluid, means whatever we drink, it's just get rid of by the kidney, maintaining the hemoglobin by formation of the RBCs, and also the healthy bone. Next slide. So now the thing is what we already talk about the healthy kidney, where it is there, what is the function, and now important part to know is the why do kidney fail? Because like God has given two kidney, and if one kidney fails, the other kidney always take care of your whole body function in terms of waste product removal as well as the water intake. But if both kidney fails, then what will happen that your certain symptoms or certain problem will arise because of kidney is not able to handle all this function what I mentioned in the previous slide. So the reason behind the kidney failure, because one kidney failure can happen when there is some sort of stone or infection in the one kidney, or the kidney by birth is a small size and not functioning well, or it could be because of poor blood circulation or poor blood flow in the single kidney which can lead to a single kidney failure. But when both kidney failure happens, usually most common cause is a diabetes. In diabetes there are two type of diabetes, type 1 and type 2. In type 1 diabetes, usually we see kidney failure happens after 10 years or 15 years down the road. But in case of type 2 diabetes, sometimes we see when patient comes to the OPD for first diagnosis, they may have some sort of kidney problem to start with immediately, even diagnosis of type 2 diabetes. So every patient with type 2 diabetes should be monitored for the kidney function. So long-standing poorly controlled diabetes is one of the major cause of kidney failure in our society. Other cause is a long-standing poorly controlled hypertension, various drugs. Sometimes like patient are taking drugs without knowing that what are the side effects. And most common being used is the painkillers, non-steroidal anti-inflammatory drugs. They directly affect on the kidney, and if it is consumed for a long time for your pain, that can lead to kidney failure. Certain condition which leads to inflammation of the kidney disease, that is called as a connective tissue disorders like lupus nephritis, rheumatoid arthritis. So these are the inflammatory disease of the kidney which can lead to a kidney failure over a long run. Even vasculitis. So there are other immunological disorders which can also affect the kidney. Another cause of kidney failure is infection. So many times we see the infection coming in the ICU, infected patient with the lungs. So most important part, the infection which can lead to the kidney failure is the infection of the kidney itself. It is called as a pyelonephritis. So a person who get the urinary tract infection and it leads to involvement of the kidney, which always leads to some sort of scarring on the kidney, which leads to loss of kidney function over a period of time. So repeated urinary tract infection leads to a kidney failure over a long run. Also, I mentioned about some person or some like out of lakhs people, that one or two people will have a abnormal kidney to start with from your birth, because kidney is being developed from mesenchyme of your embryo. And actually, during the development, there is a process in which two part of our developmental process will join to make the kidney. So in that process of fusion of the kidney part, there will be some sort of abnormality which leads to abnormal kidney. So in that group of patient, the kidney will not be exactly in the same side what we see, and they may be in the lower part of the abdomen. They may be twisted, though they may be attached together, and they have a unique kind of draining pipe, that is ureter. So the number of these kind of abnormal kidney is not that great, but still there are some people which have a abnormal kidney, that is called as a horseshoe kidney or ectopic kidney. And last but not least is a hereditary condition. So hereditary condition, what we see most commonly is a polycystic kidney. The polycystic kidney is because of X chromosome defect, and usually it runs in the family. So whenever you have any patient with a polycystic kidney disease, you have to have a family tree to see whether there is any family member is being affected by polycystic or not. So these are the most common cause what we see in our day-to-day practice about the reason why the kidney fails. Other causes of renal failure are also there, but sometimes we may not even able to find out the proper cause of the kidney failure, and they'll end up with a small kidney, and we don't know the situation. Again, there is another reason for the kidney failure is a recurrent stone disease. So there are certain zone in Gujarat itself, or maybe in India itself, like they have a very hard water to drink with, and they have a like tendency for recurrent stone formation. So every time stone formation happen, it leads to some sort of water retention, or sorry, urinary tract obstruction. And on the background of stone obstruction, if they get infection, they get rapid deterioration of their kidney function. So any person who have a stone disease should be evaluated, should be treated properly and appropriately without delay. Next slide. So what happened when kidney stop working? That's one thing. So everybody will develop all the symptoms. What kind of symptoms will be there? What are the symptoms which are alarming and to be taken care of right away? So let's say for any kidney dysfunction, what we say, the creatinine value, normally creatinine value for male is like, I would say, 1 milligram per deciliter. For female it is 0.8 milligram per deciliter. So when the kidney function deteriorates, the creatinine will go up, and depending on their stage, like there is a stage 1 of 1 CKD, stage 2 CKD, stage 3 CKD, stage 4, and stage 5. So chronic kidney disease per se have a staging. And depending on the no any symptoms happen. So early stage of CKD, it is always be. Stage 3, 4, and 5 CKD, they have some symptoms. Means some patient will pick up their symptoms, or the treating doctor will pick up the symptoms, and they will refer to the nephrologist. Most of the patient what we see in our community comes with the stage 4 and 5. So at that time we don't have any option to treat them, to control their kidney disease, so that they can stay with that whatever the left behind kidney. So that's the real problem. So most of the time what we see is that patient comes with like low urine output, swelling on their face, swelling on their feet. Sometimes, like if they comes to a later stage, they come with like weakness, fatigue, tiredness, breathing difficulty. So it's a kind of mixture of symptoms will there in all of these patients what we see in our day-to-day clinic practice. Some of the patients, they have said that like they have a completely odd kind of taste and odd kind of breath in their mouth. And some of the patients, they have like early morning nausea and vomiting. Few of my patient came with like weight of loss of weight, or like in very severe cases I have seen patient come with a seizure, that is called as a convulsion or epilepsy. Next slide. What are the sign of kidney damage? Uh, so there will be blood in the urine, there will be protein in the urine. You can see some abnormal blood tests in terms of serum creatinine and urea. You can have an ultrasound which shows some sort of abnormality in the kidney, in the structure as well as the, like in their anatomy. And so many times, if that's the early stage, we do a kidney biopsy and we find out or picked up some sort of immunological disorder. So this could be the signs of the kidney damage. So you, for that, you need to have a look in that, because so many times in the blood in the urine, like as a normal lay person, you may not be able to find out. So you have to go to the laboratory, and if you have a laboratory test showing that there is some blood in the urine, you need to have a further workup. So many of these symptoms are not being picked up. So for that, you need to have a like kind of watch. You have some sort of like early detection. That is only possible by routine investigation. So in our society, still we don't have a routine checkup for all adults after 30 years. That should be done in our society. And if they have a no problem, they can do it after 4 or 5 years again for your body checkup. But that should be implicated in our society, that every person should have a routine investigation. If they are fine, that's fine. They can repeat again after 4 to 5 years. But if they have some abnormality, they can be picked up very early and can be treated in the early stage. Next slide. CKD symptoms, as I mentioned, some patients have like decreased appetite, nausea, vomiting, weight gain or loss. I usually say weight gain is very less until and unless there is a nephrotic syndrome, in which there is a lot of protein in the urine, and most of the patient that ballooning up, and that ballooning up is because of water, a lot of water retention. But most of the chronic kidney disease patient, they tends to lose the weight, change in the bowel habit. Most of them, they get some constipated. In later stage with severe uremia, they tends to get loose bowel motion, because bowel is trying to work or prevent like or trying to remove the waste product by means of loose bowel motion. There is a decreased sensation in hand and feet because of the neuropathy, and this is more common with the type 2 diabetic patient because of the diabetic neuropathy. Another side symptoms are the tiredness, decreased concentration. So, young guys who are like learning in the age or in the school or in college, they tends to have a poor educational background, and they lead to a poor concentration and not able to concentrate in that study. Frail to appearance. So some of the patient will not able to reach to their specific target because of the CKD. Decreased sexual functioning. So that is very common. Erectile dysfunction in the male, and same thing on the female is also being found with the advancement of the CKD. In female also, you can see that there is a disturbance in the menstrual cycle will be also there. They will not able to have a child because of the CKD and having chronic kidney disease associated toxemia. Also, there is some sort of bronze or discoloration of the skin will be there. Most of the time, this is because of melanin. What we see, so many patients complain with skin pigmentation, most commonly seen in the legs, and that could be because of higher melanin in this group of the patient. Next slide. So, delayed CKD detection can lead to serious consequences, and this is like very common what we see in our society. As a nephrologist, I would say like it is very pitiable situation that most of the time what we see the patient in stage 4 and 5 CKD means their kidney function is down by almost like left behind with 20 to 25%. So at that time, as a nephrologist, we don't have a too much to offer, because they have a lot of protein in the urine, their kidney is being shrunken, and they have like so many signs and symptoms of kidney failure. So early detection is most important part for the prevention of the chronic disease, chronic kidney disease, because CKD per se, chronic kidney disease per se, will carry so many other complications, morbidity and mortality because of high blood pressure, because of cardiovascular disease. They tends to have a high chance of myocardial infarction and severe stroke. And along with that, this patient population have a poor nutrition because their appetite is being poor. So they have a complex structure of diabetes, high blood pressure, cardiovascular disease, malnutrition. So out of this, they have a like pathetic lifestyle with morbidity and mortality. So always, if they have been seen by a specialist doctor in the early stage, they can definitely give a better outcome in this patient population. So lack of patient education for prevention or treatment is there in our society, that needs to be no focus, and that individual patient can reach to a specialist in the early stage. So many times the patient land up to see a nephrologist when they have a like uremia and they need to start the dialysis. So again, here is a problem. When they come with like advanced CKD, they have no vascular access. We'll end up putting a temporary catheter in their neck, and then we refer for the fistula creation. So if such patient is being followed by nephrologist for a long time, we prepare for the dialysis in the early stage so that they can have a easy vascular access, and also like they save money also. And not only that, it is a smooth transition from the chronic kidney disease prevention management to a dialysis if the disease progress. Next slide. So again, this is the same repetition of the slide. Why do kidney fails? As I said, most common is a diabetes followed by hypertension. No doubt there are some sort of like preventable risk factors are the smoking, high cholesterol. Any patient having family history of chronic kidney disease, there is a chance for that family members can have a down the road kidney disease, especially for hereditary disease like polycystic kidney disease or hypercalcemia or familial hypercalcemia, which leads to a recurrent stone disease. Age, gender, again, in as your age advance because of geriatric age, there is also your kidney tends to have a poor function because of the loss of certain nephrons. And on top of it, if they have hypertension and diabetes which is not properly controlled, they tends to get more kidney problem. Race, obviously, African American are high risk for the chronic kidney disease. If you are taking certain nephrotoxic drugs like painkiller, those with osteoarthritis and chronic back pain, they are taking painkiller without like asking their doctors, they tend to get the kidney problem. Again, in certain special condition like ICU in setup of cardiology, they are doing on and off angiography for chest pain and angina for coronary artery disease. So if by chance a certain patient have a high risk for the kidney and they are using contrast material, they tend to get the kidney problem. But here there is a problem with acute renal failure. If they have a chronic kidney disease on the background, they land up on a dialysis sometimes with the chronic dialysis. But so many times they come out of acute kidney condition and back to a previous condition. Next slide. So how to prevent the chronic kidney disease? Again, this is like very big topic. So I would say it from basic. Like if you have a diabetes, make sure it is well controlled, being seen by a physician and properly being guided with looking on the all aspect of the diabetes, including obesity and lifestyle, so that that will lead to a better control of all the macro and microvascular complication of the diabetes on the long run. If you have by chance hypertension, make it proper control of the hypertension. Make sure whatever the antihypertensive being used judiciously, properly, and with the proper interest for the hypertension control. Avoid unnecessary use of nephrotoxic drug. Again, so many patients in the society with the back pain and knee pain, they are using like NSAID because it is available over the counter, and misuse of this drug without knowledge will lead to a kidney problem. So try to avoid use of painkiller. If you need a painkiller for long term, you see your doctors. Make sure your kidney function are okay and use it judiciously whenever there is a need. There are certain painkiller which are available which are not having nephrotoxicity, can be used in certain like any patient with the early chronic kidney disease or those who are at risk for the chronic kidney disease. Control your weight because again obesity per se directly affects for the glycemic control. So any obesity have a risk factor for diabetes as well as the hypertension, and obesity itself leads to proteinuria. So weight reduction is one of the base reasons for prevention of the CKD. So yeah, if you have a comorbid obesity, you should go for the weight reduction by means of surgery or by any dietary changes. Stop smoking, though smoking does not have a direct effect on the kidney, but yes, it has a lot of cardiovascular impact in terms of like your hypertension, coronary artery disease, and per se hypertension itself can lead to effect on the kidney. Regular health checkup, as I said, should be implicated in the society. If you see in the Western world, like US, Canada, they have like every 3 months or 6 months, there is a regular checkup of your body in terms of various routine investigation, so that any person who have a very early disease in terms of your high BP or some sort of sugar or some kidney disease in terms of urine abnormality can be picked up at the early stage and that is a very very win-win situation for preventing or progressing the disease in the early stage. Healthy diet again, in the develop, like in the era of like fast developing economy, there is a lot of problem with the healthy diet per se. But yeah, make sure you have a lot of liquids and fruit juice and vegetables. Try to avoid refined carbohydrate. Use high fiber carbohydrate to avoid obesity as well as the glycemic control. And regular exercise should be implicated in your day-to-day lives to have a healthy lifestyle. Why kidney prevention is important with the diabetic and hypertension? So, as I said, out of 100 diabetic patients, 40% patient will develop diabetic kidney disease. Not 100%, but 40%. So, if you take care of your sugar control and blood pressure very nicely, you tends to have a better management of the kidney failure, because down the road in type 2 diabetes, what we see after 10 years with the poor control of blood pressure and diabetes, they tends to get the proteinuria, so protein in the urine, and which leads to kidney failure. So if you manage your blood pressure and sugar control with good management, you tends to prevent your chronic kidney disease because of diabetic nephropathy. Next slide. When to get tested? So if someone asks me, should I get test for my kidney disease, then I have to have a look their profile whether they really need it or not. But I would say every person should have their basic test, and if they have abnormality that needs to be followed, and how frequently it depends on what kind of abnormality. So let's say, as I said, for diabetes is one of the most common cause. For type 1 diabetes, they don't see any kidney problem down the road up to 5 to 10 years, but later on they tends to show a protein in the urine depending on of that if they get hypertension. So for type 1 diabetes, after 5 years they should check their kidney test in terms of creatinine, urine test in terms of urine albumin to creatinine ratio for albuminuria. If it is normal, then it should be repeated annually. In type 2 diabetes, whenever they get diagnosis of type 2 diabetes, it should be tested, because you don't know here whether the diabetes came just today on only, or it was being hidden for a long time. Because if the hidden sugar, it always leads to a lot of damage in your vital organs. So whenever a person who diagnosed with the type 2 diabetes, you should check their kidney function in terms of blood test and urine analysis. If they are normal, then you can check annually. If they are abnormal, make sure their proper management is being done, and then it should be repeated 3 to 6 monthly. Hypertension, you should start diagnose and initiation of therapy, and then every 3 years you check your GFR, microalbumin test. If they are normal, just repeat every 3 years to make sure they are stable. Any person with a family history of kidney disease should have their kidney test being done at least 3 years, and to be repeated as per the need. The testing intervals are recommendation are based on the physician opinion. So let's say for a patient with the frank proteinuria, I always ask to do a urine test every 2 weeks if they are on specific therapy, to make sure that whether they are effective or not, and whether there is any response to the therapy what I have initiated. So always frequency of the test depend on your physician who is taking care of, and how frequently to be done, what needs to be monitored is to be depending on their physician and how the response is. Next slide. Uh, for any kidney disease, most important part is the blood pressure. So question arises, what numbers should be there? Because if you see in the various societies are there, they recommended like this target of the blood pressure and that target of the blood pressure. So if you see, there is an American society, they have their different guidelines. Then there is a ANC, there is a European guidelines, there is a Canadian guidelines. But for kidney disease, we always try to keep the blood pressure less than 125 systolic and 85 diastolic. If we can achieve further down, it is always good to make sure that patient should not get any symptoms. But any blood pressure less than 100 is not recommended, because it can lead to another complication from cardiovascular endpoint. So target blood pressure should be at least less or equal to 125, 85, and if we can go a little lower without any symptoms, it is much better. Medicines should be taken as per the direction of the physician. Always limit your salt and sodium intake. So any person with a hypertension, what we say, have a sodium intake should be 1.5 to 2.5 gram, and if it is in terms of salt, it is a 3.5 to 5.5 gram. So that limitation should be there, because that will help to control the blood pressure, and also it optimizes the effect of your antihypertensive medicine. Next slide. Weight and smoking, again, there should be ideal weight. Ideal weight, like if you see in the society, you will not find any ideal weight person. Only few will have a proper BMI. But again, yeah, if you have any obesity, in terms of mild obesity to comorbid obesity, always try to reduce the weight. It has a lot of advantage. How you are gonna reduce the weight? There are a lot of ways to do that. Maybe a diet, maybe a good counseling with the dietitian, maybe some sort of surgery. But definitely, it has a role. Smoking, as I said, directly no effect on the kidney, but yes, for the hypertension, quit smoke. That will definitely helps to have a proper control of the blood pressure. And not only that, it has also benefit in terms of cardiovascular death. Next slide. Play active role in taking care of your health. So always, whenever, like as a nephrologist, I always like initiate or push my patient to monitor the blood pressure at home by self, and also the blood sugar, because no, that's why we are involving the patient for their personal care, and that's why they are more keen and they are having more compliance with that medicine, because that's the only way. Because if you just leave behind with a prescription saying that you have to take this medicine and that medicine, that will lead to non-compliance. So if you want to improve the compliance of your patient with the medicines, always involve your patient in your management. So ask them to have a blood pressure machine at home, ask them to check it at home, so that they know that what are the number and what should be taken care of. No, this is the most important part as a physician. When you are treating your patient, always involve your patient in your management. Don't just physician when you're treating your patient. We add some we add some sort of like antihypertensive drugs for proper management. So always you closely follow with your physician or nephrologist, so that any complication or side effect of the medicine should not happen over a time when you are treating your patient. Next slide. So concluding my talk, it is possible to identify people at risk of CKD. How? Maybe doing a regular checkup, even in the healthy population. Make some norms to start your investigating, or just doing a routine checkup. You can pick up so many CKD patients in your population. The importance, early detection. Sorry. Okay. Screen for early CKD with easy to do the test. Effective preventive therapy should be implicated at the earliest. It is feasible to detect early CKD and prevent its development, as I said in all my previous slides. Thank you. If you have any question, yeah, I'm happy to answer at the same time.
Thank you, doctor, for providing us with such insights over this particular problem. Now we'll
Yeah.
take some questions from our viewers. So,
Okay.
doctor, first question from our viewer is, what are the different stages of chronic kidney disease?
So if you see, there is a KDICO guidelines that is a given. This guidelines is given by National Kidney Foundation, and the importance of this stage is to detect at the early stage and to prevent various complication of the chronic kidney disease. So not every patient needs to have a complication of chronic kidney disease. We see a chronic kidney disease complication to start with the stage 3, 4, and 5. So beyond stage 3, we see the complication of the kidney disease. And stage 1 and 2 are pretty much like having no complication. They are just early detected cases. So if we see that kind of patient population, definitely it is going to make a benefit over a long run. They may not even progress to end-stage renal disease, dialysis, and transplant. So these are the patient population needs to be diagnosed and needs to be identified early, so that they can get benefit. Most of the time, what we see is the patient in stage 4 and 5. So if you like looking for the staging, stage 1 is that GFR is more than 60. Stage 2 is again that GFR is 60, means their creatine value will be normal as per the blood test. But they have some urine abnormality. They might have some protein in the urine. They might have some blood in the urine. or if you see their ultrasound may have some sort of structural defect, but their kidney function is pretty good. But they can get a kidney problem if they don't take care of, in terms of if they get blood pressure, there is a load on the kidney. If they by chance get a diabetes, they get load on their kidney. If by chance they take some sort of painkillers or nephrotoxic drugs, that again leads to a kidney problem. So if you identify this patient population, just guide them, giving some sort of hint what you need to do. That's fine. That's good enough. So this is a stage that a lot of role of a physician, society to pick up that patient population so that they cannot progress to end stage. Now comes to the stage 3, 4, and 5. Means stage 3 CKD is that GFR is less than 60 but more than 30. Here, most of the complication they start with. So if you see a by a nephrologist, by time they try to cover whatever the complication in that stage can be properly dealt with, and whatever the further preventive measure can be done so that they cannot progress to 4 and 5, or it can be delayed. So the staging is important as a nephrologist is to have a certain action at specific time. If my patient comes to stage 4, I have pretty much very less role in terms of preventing the disease because they are already progressed. Now the question is that how to prepare for dialysis and whatever the kidney function left with them so that they can further drag with the same kidney till they'll end up on dialysis and transplant. So here all the stage have an importance. Yeah, for 1 and 2, physician can definitely play a good role. 3, 4, 5, nephrologist should be there to treat and to guide the patient in that stage.
Okay. So, doctor, when we talk about medications for these patients, so are there some medications which these kind of patients should avoid?
So main common thing is like painkiller. Painkiller has a direct kidney effect. So that's one thing should be keep in mind. Any person who have any sort of kidney failure risk or chronic kidney disease risk should avoid the painkiller. There are certain situations in which they needs to have a painkiller for like 1 or 2 doses. That's fine. That is not going to harm their kidney function. But yeah, if it is going to be consumed for a long run, definitely it leads to kidney failure on a long phase. So there are painkiller available. It is not like that they have to suffer the pain. There are painkiller available which has no effect on the kidney, and that should be tried, and that should be consumed without any effect. So painkiller is one of the important like medication which can have a direct impact on the kidney. Going to the another medication is the contrast material. So many patient goes for the angiography, coronary angiography, and who are the people who go for the coronary angiography? They have some sort of cardiac disease. And why they have a cardiac disease? Because they have hypertension or they have a diabetes. And so many times they have never been checked up for the kidney. They just land up. They said like I have a chest pain. They just go to the cardiologist. They do an angiography. But at the same time, this patient also needs to make sure that they have no underlying kidney risk before they land up or they go for angiography, because the contrast material is being filtered by the kidney. So if your kidney is not functioning properly or some poor function to start with, they'll end up with the kidney problem. That is another medication. Now third medication is various antibiotics. We use so many antibiotics for infection, viral infection, bacterial infection in ICU setup and all the things. So many antibiotics have some sort of allergic kind of reaction to the kidney. So it is always the physician who is treating has a guiding hand and the controlling hand how to take care of with the medicine. So it's very hard for a nephrologist to like put a break or to guide a patient. Let's say by this is the medicine should be avoided. So it is always the treating doctor has a guide and they have to control on that. Another things are like Ayurvedic medicines. I'm not against the Ayurvedic or homeopathic, but so many times when we read the Ayurvedic preparation, we don't have anything exactly what they are providing. And so many times they have a heavy metals or maybe some sort of steroids, and they have some sort of like nephropathy. I have seen my patient being stable, converted for some sort of driven by some family members, and then they choose to have like Ayurvedic or homeopathic preparation, and they turns to have very fast kidney failure. So there are certain preparations are there which can lead to a rapid decline in the kidney function. So these are the certain things that what we see in our practice should be taken care of. Another group of medicine is like cancer therapy, chemotherapy. So many times like chemotherapy being administer and they have some impact on the kidney function. So always any person have some risk of the kidney should monitor whenever they are on this high risk medicine.
So another question we have from our viewers, doctor, that can chronic kidney disease cause other health problems also?
Yeah, so if you see the literature across the globe and looking to the all various papers, chronic kidney disease patient per se will not die because of kidney. Because if the patient get the kidney failure, we give them like dialysis support, or if they're ready for transplant, we do a kidney transplant. So how the death happen for chronic kidney disease? The death is because of infection or because of cardiovascular death. So most common cause is the cardiovascular death, means heart related complication. Either it could be a heart attack, heart failure, maybe a CV stroke, means like brain stroke, or maybe some sort of narrowing in the blood vessels, which leads to a, like peripheral vascular disease, and so on and so forth. So common cause of the death is heart. So all the patient with chronic kidney disease, as the stage advance, the risk goes high. So let's say for stage 1 and stage 2 CKD, the risk is maybe 2% of cardiovascular death, which jumps to almost 40 to 50% when they are on dialysis. So kidney failure patient, highest cause of the death is the cardiovascular death. Second cause is the infection, because all the patient with chronic kidney disease, they have a poor immune response. So they tends to get more infection related complication, as we see like like the current pandemic of COVID also. If you see the review the literature also, dialysis patients suffered a lot with the COVID, and they tend to lose their life because of the COVID infection, because they don't have a that much immune response to fight with the virus. So when they'll end up with any infection, they take long time to get recover from that. So this is a risk factor for chronic kidney disease and their possible cause of death.
So another question we have from our viewer, doctor, that should CKD patients take inhibitors or ARBs for kidneys?
Yeah, definitely. Any person who have a chronic kidney disease and having protein in the urine, for sure they should be on ACE inhibitors and ARB. Now question is that up to what stage you should prescribe and up to what level you should not give it. It's always depend on the comfort of nephrologist and how patient is a compliance. If my patient is not going to return back, I would not start ACE inhibitors and ARB. Reason why? Because when I start this medicine, there is a rise of the creatinine happen with this molecule. So let's say if I am starting any patient with the 2 creatinine, I start ACE inhibitors and ARB, their creatinine goes up to 2.5. So in that situation, I need to monitor that it is not jumping beyond and it is stabilized, because this is the medicine which reduces the if pressure effect on the kidney. So it will reduces the progression of the chronic kidney disease. It is the beauty of this medicine, but at the cost of little rise in the creatinine value. So that certain lay patient, lay person will not have that kind of insight. So always a compliance is more important. Again, this with this medicine, there is a risk of high potassium, hyperkalemia, and hyperkalemia is one of the most common cause of cardiac arrest. So that needs to be monitored. So always, yeah, fine any creatinine, even 4-5 creatinine. I have few patients who have been on ACE inhibitors and ARB with the 5 creatinine. Certain nephrologists may not be comfortable, but it depends on your how gut feeling and your compliance of the patient, because it's a wonderful molecule. But yeah, needs to be tailor made. It needs to be under confidence of nephrologist and your patient.
So, doctor, last question for the session, that are there any home remedies or lifestyle management for to overcome CKD?
See, home remedies like more of your healthy lifestyle, because there is no such home remedy. Actually, it's your health. So individual should understand their health in terms of like regular exercise, in terms of their food intake, in terms of their liquid intake, also like to have a regular checkup. So these are all basically it's a normal norms that everyone should have their proper checkup of their body, to look after their body, because body is not like something machine that you use and then don't look after that. So have to have a regular exercise, have to have a regular checkup of your body. I think that's a good enough for to have any disease to prevent. Because chronic kidney disease per se, like why you need to have a kidney disease per se? just avoid everything. You don't need to do anything else. But for that, you have to have like your initiation from your within yourself. That is the only way, because someone will guide you saying that you just go for the blood test. It's not that. You should have your test done. Like, look for that. If you're fine, maybe every 4 or 5 years to do it. Make sure that you are healthy. And again, food intake is also important, because so many times we have like raw food, or very high carbohydrate food, which can lead to obesity. With sedentary lifestyle, it will end up with the hyperglycemia and glucose intolerance, which leads to further disease. So why you just change your lifestyle? That's the most important. And do it. Also reduce your stress by doing yoga. This is basically, you have to have like your own initiation about all these things, because for that there is nothing home remedy. It is within yourself.
Okay. Thank you, Doctor, for providing us with such great insights. Thank you for your time for the session, for doing the session with us. This marks the end of this session. We will be back with more details in another session. Till then, stay tuned.
Yeah, sure. Thank you, Isha. Bye.